Good morning. It is my honor to be here today and to present the Family Planning 2020 commitments on behalf of the Government of Cameroon. Cameroon has one of the highest rates of maternal mortality, all of you know about that, and a fertility rate that has remained stagnant but high in the last 15 years. Each woman in Cameroon has an average of 5.1 children, with a low rate of contraceptive prevalence of 16.1% of all women of reproductive age, especially in the rural areas and among the youth, and a high rate of unmet needs of about 17%. So the government of Cameroon has repositioned family planning as a priority strategy to bend the curves of maternal mortality in the country. The indicators that I've just mentioned vary in the different regions of the country. The government of Cameroon is committed to reaching ambitious targets in family planning, especially increasing the contraceptive prevalence rate from 16.1% to about 30% of all women of the age by the year 2020, and reducing unmet needs from 17% to about 10% by 2020. These are the targets that have been set in our reproductive, maternal, neonatal, and infant health strategic plan of 2014-2020. This will mean that almost 1 million more women and girls have access to family planning methods of their choices in Cameroon by 2020. As access to services increase, we will ensure that all women of productive age have access to quality family planning services that respect their choices. The government of Cameroon is financially engaged in ensuring the accessibility of contraceptive and family planning services to the population. In 2012, we instituted a budget line for the purchase of contraceptives in the national budget. We aim to increase this budget line by at least 5% each year, dedicated to the procurement of contraceptive, and will ensure that the budget line is put in use each year. To improve our geographic and financial access to family planning services, the Minister of Public Health will design a system to subsidize family planning services for the target population, especially adolescents, youth, and vulnerable women. The Department of Family Health, which I head, will advocate for the government to increase financial support to reproductive health by 5% per year, including the amount dedicated for family planning. In addition, we will also look on to non-traditional private sector and civil society organizations to support family planning. The Minister of Public Health will take innovative new approaches to increase the availability and accessibility of family planning services, including community-based distribution of short-acting methods by community healthcare workers, to more effectively reach out to women in rural areas. We will ensure that facilities offer the full range of quality modern family planning services, including counseling, that providers are trained in family planning and subsequently receive supportive supervision. After many years plagued by constant stock outs of family planning commodities, Cameroon now has sufficient supply of stock to meet the needs of its population. We will continue to ensure that all methods of contraceptives are available in sufficient supply to meet the needs of the population and eliminate stock outs as at the central, regional, and particularly the facility levels. As the leader of family planning in Cameroon, the Ministry of Public Health will collaborate with other ministries to enhance a multi-sectoral approach to improving family planning services throughout the country. Under the leadership of the Minister of Public Health, there is a strong platform of coordination and collaboration at the central level between the Ministries of Public Health, financial and technical partners, and the civil society organizations. This coordination has been essential to the development of our Family Planning Operational Plan 2015-2020, which clearly outlines the priorities of family planning over the next 5 years. The Contraceptive Security Plan also has been developed for 2014-2020, and harmonization and revision of prices for contraceptive and family planning services. We will continue with this important coordination at the central level, as well as improve on the regional level coordination of family planning activities among ministries and partners. Family planning is a priority strategy for Cameroon in the reduction of maternal mortality, beginning with a campaign for the reduction of maternal mortality and the reposition of family planning. We see this as an opportunity to declare our commitment to family planning in Cameroon, share experiences with other countries and partners, and advocate for financial and technical support for our family planning program. We are pleased to be here today representing the Government of Cameroon and to present our Family Planning 2020 Declaration. Thank you very much.